Hi, I'm Leah Hoprector, and I will be going over mandatory reporting and overview with you today. And I have a slideshow that I will be sharing with you. I don't know if that worked or not. Okay. This is my first time, so please be patient. Okay, all right. So doing the slideshow from the beginning, and the overview that we will go over will be let the numbers speak for themselves, types and signs of abuse, indicators of abuse, reasons children are abused, roles as mandatory reporters and procedures for reporting abuse, Iowa data, and review of roles. Reports are made in terms of the child's possible condition, not in terms of an accusation against parents. A report of child abuse is non-accusation, but a request to determine whether child abuse exists and help begin the helping process. Making a report of child abuse may be difficult. You may have doubts about whether the circumstances merit a report, how the parents will react, what the outcome will be, and whether or not the report will put the child at greater risk. The best way to minimize the difficulty of reporting is to be knowledgeable of the reporting requirements and be aware of DHS's intake criteria and the response that is initiated by making a report. Some things that do get reported are license truancy. License truancy are often reported as child abuse allegations. However, the endangerment does not generally rise to the level that may be present to constitute a child abuse allegation. If other conditions are present or the situation poses a risk to the child's health and welfare, it should be reported as suspected child abuse. Such conditions may include a caretaker not properly treating the lice, or a caretaker not sending a child to school when a professional evaluation has determined that a child has a special need to be in school because of a diagnosed disability. Even if the report is rejected for assessment, other services may be available to the child and family. Who will know the name of the person making a report of child abuse? DHS will safeguard the reporter's identity during the assessment process. However, the reporter should be aware that continued confidentiality cannot be guaranteed if the report results in juvenile, civil, or criminal court action. In Iowa, some numbers from 2020, 30,151 assessments were done. 6,398 were founded. The year before, 2019, 33,004 assessments were done and 6,891 of those were founded. The numbers are a little bit different because we were in COVID times. So that could be a factor of why those numbers are 2,000 and some different. Looking back in 2010, there were 32,841 assessments, and close to 10,000 of those were founded. The law requires the reporting of suspected child abuse. It is not the reporter's role to validate the abuse. The law does not require you to have proof that the abuse occurred before reporting. The law clearly specifies that reports of child abuse must be made when the person reporting reasonably believes a child has suffered abuse. Iowa law directs that teachers, schools, childcare workers, office workers, etc., must make a report of child abuse within 24 hours when they reasonably believe a child suffered abuse. A mandatory reporter may also report suspected child abuse outside the scope of their professional practice as a permissive reporter, such as you were at Walmart or at some kind of an event. You are a mandatory reporter. 11 types of child abuse under the Iowa Code Section 232-68 are physical abuse, mental injury, sexual abuse, denial of critical care, prostitution of a child, presence of illegal drugs or dangerous substances, bestiality in the presence of a minor, allows access by a registered sex offender, allows access to obscene material, or child sex trafficking. Things to look for. Signs of physical abuse. Physical indicators are unexplained burns, bites, bruises, welts, lacerations, broken bones, black eyes, or cigarette burns. Bruising, welts, or burns in atypical places like the backs of legs, thighs, bottoms of feet, underarms, stomach, bruising in various stages of healing, fading bruises or other marks noticeable after an absence from school. Behavioral indicators: if a child has extreme aggression, they're withdrawn, uncomfortable with physical contact, of closeness, or flinches if you go near them, seems frightened, or may protest when it's time to go home. Parent guardian indicators that abuse may be happening. They may have a history of abuse as a child themselves. They may offer conflicting or unconvincing information or have no explanation for their child's injuries. Sees the child as a burden, they're bad, they're hyperactive, they may be different or difficult in the parent's eyes or guardians. Some neglect issues, denial of critical care. Failure to provide adequate food and nutrition, or to provide shelter, adequate clothing when the weather changes, adequate health care or mental health care, failure to meet the emotional needs of the child, or failure to provide proper supervision. Things that you might see: frequent absence from school. They may arrive early and leave late. They may hide, steal, or beg food. They're always hungry. They may be filthy in the same diaper or pull-up that they were in the day before. Some indicators that you may see with parents or guardians: shows no interest or concern for the child. They may behave irrationally or in an unusual manner. They may abuse alcohol or drugs. Some signs of sexual abuse, some physical indicators: the child may have difficulty walking or sitting, wearing torn, stained, or bloody underwear, pain or itching in genital area, pain during urination, sudden change in appetite. The child might report nightmares or bedwetting, or presence of an STD. The child may act withdrawn. They may act younger than their age. They may start regressing. They may start exhibiting inappropriate sex play, make sexual advances, or have advanced sexual knowledge. They might be threatened by physical closeness or contact. They might try to run away. Extreme weight loss or gain. They're emotionally inconsolable. May have tantrums or changes in behavior for no apparent reason. And they may even tell you about an encounter. Some signs of sexual abuse with parent guardian indicators: they might be secretive or isolated, overprotective of the child, limiting the child's contact with other children, especially of the opposite sex. Might be jealous and controlling with family members. Some physical indicators might be delayed in physical, social, or emotional development. They may have attempted or talked about suicide or self-harm, and lack of attachment to the parent, reactive attachment disorder, or RADS. Some behavioral indicators: shows extremes in behavior, overly compliant or demanding, extremely passive or aggressive. They're always watchful, as if preparing for something bad to happen. They may show inappropriate adult or infantile regressive behavior, parenting other children, acting as an adult, frequent rocking, headbanging, self-harm, or other infantile behavior. Some signs of emotional abuse, parent guardian indicators: constantly blames or belittles or berates the child, unconcerned about the child and refuses to consider help for the child's problems, and they might overtly reject the child. Why do children get abused? There are many things that can contribute to that. Some of them might be some mental health issues, abuse of alcohol or drugs, stress from things going on in the family, work. There are many many things that could contribute to why children get abused. One of them could be that it was a difficult or unwanted pregnancy, that the child was born the wrong sex. They may have wanted a boy and they got a girl. You just never know. The child may have been or may be too fussy, colicky, difficult to deal with. They may be too active or might be too passive. Other family stressors, again, could be lack of work. They may have other things going on. They could be abusing drugs or alcohol. The child could resemble the disliked parent, and that has some hard feelings for some people. The parent or guardian could have been abused or neglected as a child themselves, lack of parenting skills. So, what can you do? Just try to make a difference in their lives. Somebody else may have already reported it. I'm just one person. I can't stop abuse. But mandatory reporters are individuals who are obligated by law to report suspected cases of child abuse and neglect. All Head Start and early Head Start staff are mandatory reporters. Mandatory reporter laws are designed to catch abuse in its early stages so that children do not suffer long-term damage. Having a little bit of difficulties here, sorry. Mandatory reporting. Educators may spend more hours per day with their school children than their own families. That's why the role of educators is vital in the mandatory reporting process. The law requires the reporting of suspected child abuse. It's not the reporter's role to validate the abuse. The law does not require you to have proof that the abuse occurred before reporting. The law clearly specifies that reports of child abuse must be made when the person reporting reasonably believes a child has suffered abuse. It's not our responsibility to investigate or determine if abuse occurred. Our responsibility is to make DHS aware of the situation by reporting any suspected incidents of abuse. They can't protect children if they're not mindful of a situation. When do I make a report? Every time there's a reason to suspect. When you have that gut instinct and you question whether you should or not, you should just report it. You're looking out for the children. Even if you report an incident a few weeks ago, if another incident occurs, it must be reported. You are the voice for the child, so make it be heard. How do you make the report? Complete the suspected child abuse reporting form. Call to report within 24 hours. Mail the completed form to DHS. Send a copy to Matt in a sealed envelope marked confidential. Inform your supervisor and call if you have questions. How do you report the abuse? Call 1-800-362-2178 according to Iowa Code Section 232.70. If you're a mandatory reporter of child abuse and you suspect a child has been abused, you need to report it to DHS. The law requires you to report suspected child abuse to DHS orally within 24 hours of becoming aware of the situation. You must also make a report in writing within 48 hours after your oral report. The employer or supervisor of a person who is a mandatory or permissive reporter shall not apply a policy, work rule, or other requirement that interferes with the person making a report of child abuse. Within 24 hours of receiving your report, you will be orally notified whether or not the report has been accepted or rejected. This oral notification typically occurs by the end of your call to DHS. Within 5 working days, you will also be sent Form 470-3789, Notice of Intake Decision, indicating whether the report of suspected child abuse was accepted or rejected. Procedure for reporting suspected abuse by a staff member. Complete steps 1 through 5. Call Matt to notify him immediately. Matt will be responsible for making an additional verbal or written report to DHS. He'll also contact our licensing consultant. And if Matt is not available, contact the component supervisor and they'll make the necessary reports. Remember your roles and responsibilities. Be active observers and listeners. Know your kids and their families. Our families often struggle with financial, health, and our mental health issues. These struggles can impact the family's ability to care for their children. Knowing that the family is struggling but doing their best does not eliminate our responsibility and our liability for reporting child abuse and/or neglect. Trust your gut. Reporting your suspicions and concerns may protect the child and get the family help. Remember, a family assessment case allows a DHS worker to go into the home to help identify the family's strengths and needs, connecting them to any needed services. Don't assume someone else made a report. Be an advocate for the child. Law enforcement officers are seen as a symbol of public safety. They're in an excellent position in the community to raise awareness about child abuse. Law enforcement officers often encounter situations that involve child abuse. The form was updated in June of this last year, so that will be sent to you in a separate email as well. Again, if you ever have any questions, feel free to call. And also let parents know that we are mandatory reporters. Kids come to school and sometimes they have told us some pretty crazy stories over the years. Let parents know that if their child comes to us, that we're doing our jobs, that we have to report things. And again, if any of you ever need anything, just give us a call. Thank you. And if you need anything else, again, just give us a call.